Good morning, good evening, good afternoon. This is Dr. Garais, BIO116, Anatomy and Physiology 2. And we are doing, I believe, Chapter 15, quick review. Let's see if I can move this out of the way. Oh, there you go. So, of course, this is cardiovascular system, the cardiac, which is the heart, and the blood vessels, which is the arteries, veins, and capillaries. Know the differences between the arteries, veins, and capillaries. This is not a hard, steadfast rule that the arteries are typically colored red in textbooks as a convention. They're not colored red in real life. Veins colored blue, and running towards the heart, arteries away from the heart. That's the general rule, but the pulmonary artery and vein are the current exceptions. There are others, but from the lecture, those are the exceptions. Capillaries, big thing about the capillaries is they're the thinnest wall and they're the location of gas exchange. And if gases, oxygen and carbon dioxide can be exchanged, so can nutrients and, of course, wastes. The left side of the heart is the systemic circulation that is oxygen rich. The red blood cell will typically carry oxygen or oxyhemoglobin, and the pulmonary circuit will most likely carry the majority of carbon dioxide. So that circuit will be colored blue, and the red blood cells, of course, would carry carboxyhemoglobin. And here is a diagrammatic representation of that. Left side of the heart, systemic. Red is colored for oxygenated red blood cells. Blue is deoxygenated, and the pulmonary side here. Remember your orientation, right side of the heart, left side of the heart in the perspective of your patient. Your heart is about the size of your fist, located in your thoracic cavity in a specific area of your thoracic cavity called your mediastinum, which is located behind your sternum, above your diaphragm, and of course, flanked on both sides by your lungs. The base is around the second rib, and the apex, which is the pointy part of the heart, is at the point of maximal impulse, which is your fifth intercostal space. All right, the base here, apex is the point of this. These are your coronary arteries, and this, of course, is your aorta, and your pulmonary trunk, which is your pulmonary artery. You could see the heart is located, the majority of the mediastinum and the heart is to your left. Know your layers. The tough outer covering is your fibrous pericardium. And the serous layers that we already know and love, your parietal and visceral pericardium. Visceral, of course, is the deeper. And your serous layer, also known as your pericardial cavity, is in between your parietal and visceral, and that has the pericardial fluid or serous fluid, which acts as a lubricant. You can see the double layer here. Underneath these layers, you have the epicardium, myocardium, the thickest middle layer, composed of the myocardium is the cardiac muscle, and of course the most inner layer is your endocardium. Here are the layers. Of course, you have your tough fibrous, and then your parietal, and then your visceral epicardium, which is continuous. I failed to mention that in the official lecture. The visceral pericardium and the epicardium, they're considered the same thing. But again, that's the next layer. So it goes fibrous pericardium, parietal pericardium. You have your pericardial or serous cavity, And then, of course, your visceral pericardium, which is continuous with your epicardium. The thickest layer is the layer of cardiac muscle, which is your myocardium, and everything on the inside is your endocardium. We already know about these things. Atria is plural, ventricles are plural, atrium is singular. And there's these flap-like things that are sticking out of your atria. That's called your auricles. So your auricles and atria, they're part of the same thing. All these other items here, it's just best seen visually. Know both of these for laboratory, but we can ask them also indirectly, um, uh, you know, words, and please see the video that I put up on the box diagram. It's a better way of learning this. And just 5 minutes, 10 minutes a day. Practice these photographs. It'll help you immensely. Here are your semilunar valves. The one in the blue, of course, is your pulmonary semilunar valve, and the one in the red is your aortic semilunar valve. And these are the valves that are exiting your ventricles. You can see here, these are your AV valves here and here. They're called AV valves because they're in between your atrium and your ventricle. And on the left side, it's called your bicuspid, also known as your mitral valve. And here on the right side, that's your tricuspid. And those are the AV valves. And the aforementioned ones are here. Those are your semilunar valves. So there are 4 valves to this heart, 4 chambers to this heart. And connecting into the arch, the aortic arch, is your right coronary artery, which is and the opening of your left coronary artery, and these are the main branches that'll go to all your other coronary arteries that we also will mention in laboratory and in lecture. Again, here's another view. Know your great vessels. Know which ventricles are which. This is your anterior interventricular sulcus, and it houses your great cardiac vein and your left anterior descending. So if that's your anterior interventricular sulcus, this side over here has to be the left ventricle. This side over here has to be the right ventricle. If this is the right ventricle, this will be the right atrium or auricle in this case. That's that outpocketing in the atrium. And this is, of course, your left side. This is anterior view, posterior view. So look at that slide. It's very good for lab. Systole and diastole. Systole, of course, is when the heart is doing work. Diastole is when the heart is resetting, relaxing, or just filling. So if you have a blood pressure of 120/80, your systole would be 120 millimeters of mercury. Your diastole would be 80 millimeters of mercury, hence the term 120/80. The cardiac cycle is the trace of a single drop of blood starting at the left atrium all throughout the entire cycle. And please watch the extra video on the box diagram. That will help you understand this. The cardiac muscle, of course, we already know they're special because they have the syncytium. Now they have a specific atrial and ventricular syncytiums for coordination of the pumping of all the cardiac muscles for the atrium and, of course, ventricles. Another thing that your cardiac muscles have that's also special is these intercalated discs, which form gap junctions, which allow this functional syncytium to exist. And also, it's a nice, quick place for calcium to be released. The conduction system of your heart. Know this diagram. Know that your pacemaker is your SA node. The brakes are your AV node. Bundle of His, also known as your AV bundle. Left and right bundle branches, and then ending out in your Purkinje fibers. Just real quick, these are your pulmonary pulmonary veins, and this is your superior vena cava, inferior vena cava. And these little tubes in here, right, that is your coronary arteries and veins. Here's the order. Now, ECG, EKG means the same thing, and they're the different waves. So you need to know these. The P wave is atrial, corresponds to atrial depolarization, or the atrium contracting, or right before it contracts. QRS complex, which is the formation of three waves, Q, R, and S. That's for ventricular depolarization. And of course, the T wave is for ventricular repolarization. And the atrial repolarization is hidden because the QRS complex is too big. Your first heart sound is your lub. Second heart sound is your dub, lub dub, when you hear your heart. And the S1 correlates with the closing of your atrioventricular valves, your tricuspid and bicuspid. And your S2 corresponds to the closure of your pulmonary and aortic semilunar valves. The first phase, the first part is, of course, ventricular systole, and the second part is the filling, which is ventricular diastole. Very good to know. Let's look at these. I mentioned that also as well. You really need to know the internal structures, like the chordae tendineae papillary muscles, and of course the cusps. You have your bicuspid here on the left side, tricuspid here. What controls this all is, of course, the cardiac center within the base of your brain, the medulla oblongata. Also affected by your autonomic nervous system, sympathetic and parasympathetic nervous fibers. Know the differences between arteries and veins. Arteries have a thicker tunica media, therefore they are under higher pressure than veins. Veins have a thinner tunica media and under relatively lower pressure, and they have veins built in, valves, I mean, on the veins to prevent backflow. The arteries are located deep. They are also the locations of your pulses, and your veins are located more superficially. And last but not least, this letter C here, that is your capillaries. They're the thinnest walls. They have, and you can see the majority of arteries are oxygenated, majority of veins deoxygenated, but the capillaries have both, because at the level of the capillaries, that is a location of gas exchange. Another valve system here for these, for a vein. And you look at the tunica media, it is much thicker than the vein. It is thick in the artery because the artery is under high pressure. Capillaries, already discussed. You can see they're both red and blue, kind of purplish. This is, and look how thin-walled they are compared to a vein and an artery. Know your definitions of diffusion, filtration, and osmosis. These are all passive systems from an area of high concentration to an area of low. Blood pressure, we already talked about. Pulses, think arterial. Blood volume, typically 5-6 liters for a typical 70 kilogram male, which is around 144 pounds. Peripheral resistance. When we talk about peripheral resistance, we're talking about patient's blood pressure. Viscosity is how thick the blood is. The thinner the blood, the easier it'll go through the system. Remember what I always state in class, it is easier to pump water than it is for molasses. Okay. Epinephrine, we already know what epinephrine does. It is a sympathetic or sympathomimetic nervous system hormone slash neurotransmitter. Therefore, you'll have what? Sympathomimetic effects, increased heart rate, increased cardiac output, increased blood pressure, and of course, dilatation of your pupils. Venous blood flow is relatively low pressure, but it has valves to prevent backflow, but the patient needs to move around. Skeletal muscle contraction, patient also needs to breathe. So the patient has to walk around, move around, and do something, or have regular physical therapy sessions. The rest are some major arteries and veins in the system, and don't have to memorize any of these unless specifically mentioned in class. So that concludes chapter 15. Hope to see you in class. Bye.